Hi, my name is Jasmine, and my topic is AIDS, which is Acquired Immune Deficiency Syndrome. I chose AIDS because I think there's a lot of confusion among the disease and understanding what it actually is. I chose this first because through sickness, especially sickness without a cure, it can be dehumanizing and you can lose all hope in life. But we must remember that God is there with us before, during, and after. For signs and symptoms, I did it in stages, as the symptoms change drastically as the disease runs its course. In stage 1, the infected person will have normal flu-like symptoms like fever, chills, night sweats, fatigue, and muscle aches. In stage 2, the symptoms are not as intense as this is the latent stage where the disease isn't actively giving you symptoms. This can go on from 10 to 15 years. In stage 3, which is the age stage, the symptoms are the worst, where you are going to lose a large amount of weight, have a fever that comes and goes, be extremely fatigued at all times, and have signs of skin change, where your skin will likely blotch with pink, purple, and brown colors, and this is only if you are going untreated. For causative agent, the main cause of AIDS is HIV, as AIDS is the third stage. HIV is often referred to as retrovirus. HIV is a part of the genus lentivirus within the family Retroviridae, which is why it is called retrovirus. The way retrovirus hurts us is by attacking our CD4 cells, the cells that help our immune system fight off pathogens, making it almost impossible to fight off any illness or disease, even the common cold. HIV is divided into two separate types, just like diabetes is, HIV-1 and HIV-2. In the 1920s to 1940s, HIV was introduced to humans from chimpanzees in Africa. HIV-2 was introduced from a different monkey called a mangabe. HIV is an acellular infectious agent. Acellular meaning it is not living, making it impossible to kill. Infectious meaning they infect living hosts, otherwise known as human cells. Most are obligate intracellular parasites, where they cannot survive outside of the host. When it comes to pathogenesis, you can only acquire HIV from having unprotected sex or sexual activity with someone who is HIV positive, as well as through needle and syringe use. There is often a lot of misunderstanding on how HIV is transferred from person to person and fear of becoming infected easily, although it is not as easy as it seems. The ways you become infected are through a HIV positive person's fluids coming into contact with your own mucous membranes. These mucous membranes are located in your rectum, vagina, penis, and mouth. These fluids can also come into contact with the membranes on your damaged tissue like skin. These fluids include blood, semen, rectal fluids, vaginal fluids, and less common breast milk. This is the only possible way to contract HIV, not through air, water, saliva, sweat, closed-mouth kissing, insects or pets, or even sharing a toilet with someone who is HIV positive. This must be understood in order to prevent the fear and judgment of those who are HIV positive, and most importantly, prevent the spread of the disease. When it comes to the stages, stage 1 is an acute HIV infection where you are unaware that you have the virus and where you have the largest amount of virus in your blood, otherwise known as viral load. Stage 2 is the latent stage where you are asymptomatic and the virus isn't rapidly reproducing, but still you are able to infect other humans. Stage 3 is the last and worst stage of HIV and is known as AIDS, where without treatment, one will typically survive for only 3 years. So as we go into epidemiology, there are an estimated 1.1 million people in the U.S. who are living with AIDS. This is 1 in 7 people. It is estimated because it is unknown how many people are living with it unknowingly compared to those who were diagnosed. Something interesting was that in 2013 there were 39,000 new infections, but in 2018 there were only around 37,000. This is a drastic change as people are becoming more aware of prevention and treatment, and the stigma around it is decreasing. To have an idea, in 2018, 69% of those who were diagnosed were gay and bisexual men. 7% were people who injected irresponsibly or were accidentally injected. In 2019, there was a large amount of people diagnosed as stage 3, showing just how easy it is to not be aware that you have the disease until the symptoms are the worst. This being why it is spread so rapidly and why it is important to be tested no matter your circumstances. For treatment and prevention, there is a scientifically modified drug called antiretroviral therapy, otherwise known as ART. This drug slows down the rate of the virus reproducing and limits the amount of viral load in your blood, but it is not a cure, nor is there a cure for HIV. Because ART limits your viral load, you have less of a chance of transmitting it, but not fully. This drug helps your immune system stay stronger and helps to prevent drug resistance as the virus mutates in your body and you can continue to receive treatment. For prevention, if one knows that they are at risk of HIV, they can take pre-exposure prophylaxis, a drug that prevents up to 99%. They can also practice abstinence, limit sexual partners, use protection, although not guaranteed, and never share needles. The other drug for prevention that I didn't know about, and I'm sure many others didn't, is post-exposure prophylaxis. This drug is given before 72 hours after an encounter for 28 days to people that think they may have been exposed. This is important for those that are sexually assaulted, although this is a safe measure and is not 100%. Treatment and prevention are related to the Christian worldview, as we as Christians want to prevent any spread of disease. As Christians, we should hold compassion for those who are diseased and do our best to help everyone who is affected by it. The verse I chose is from the book of Mark, saying, and had suffered many things of many physicians, and had spent all that she had, and was nothing bettered, but rather grew worse. I thought this represented what many sick patients are going through, including those who suffer from AIDS. It is not easy to hold hope through a disease with no cure, but as Christians we should offer our strength in the spread of the gospel. That wraps up my summary of AIDS, and I hope it was interesting, all while being incredibly informative. Thank you.